Vasectomy decision perspective, especially people who have tried this. But there is a report that has indicated there's been a rise of up to something like 29% of vasectomies globally. People are diving into it, and in UK majorly, they say that it's more safer, and they're wishing, I wish people knew. But what is the men's decision or perspective on vasectomy? Maybe even what is vasectomy itself? Today, I'm joined by a general practitioner, Dr. Blair Chiza, and we're diving, and it's going to be demystifying the mystery of vasectomy to the depth. I hope you're ready. Just got your loins, buckle up, and let's rumble. Doctor, very good morning, and thanks for joining us once again.
Thank you so much. I'm very glad and excited to be here.
Yes.
Once again, this is home to me, Bethany TV.
Thank you so much. Yes. It's always a pleasure seeing you here. And this morning, I trust everyone's eyes are focusing, and they're like, bring it on. What is vasectomy? It's such a, not an easy term, but of course, I understand many people have heard of it. But what is vasectomy itself?
Okay. So in a nutshell, vasectomy is a permanent method of birth control, and it involves cutting or involves sometimes tying and then cutting the tubes that are supposed to move the sperms from the testicles, or what in layman they call the balls, all the way up to the end, the penis, where you move it out.
Okay.
So in a nutshell, that is vasectomy.
Okay. And is it a method, a birth control method, or what is it?
It is a birth control method.
Okay.
As I said, it's some people may call it family planning, birth control, contraceptive. So it falls in the category of one of those. Though, on the other side, it is a permanent method, unlike most of the common methods that people are aware of.
Vasectomy is irreversible.
So I would say vasectomy is largely irreversible. Okay. But there are some rare instances where urologists, other specialists that handle a male reproductive system, have attempted to reverse the vasectomy.
Are there some cases that have happened and it worked?
Yeah, the failure rate is very high, but we have a few success rates.
Okay.
So that's why I keep saying it's largely permanent, because rarely would you have someone attempt to reverse it. And even if it's reversed, chances of it being successful is really on the lower end.
All right. So why vasectomy? Dive us into this kind of mystery and,
Okay, so we as men have limited options of family planning, and you find that it's either you're going to use the natural method where you're going to withdraw, or you're going to use the modern method where we have only a condom or vasectomy. So unlike women who have like a spectrum of things, they can do pills, they can do IUDs, they can do implants, they can do injectables. Us as men, our options are very limited. And as we've seen for some bit of time, men are not comfortable with using condoms. Okay. And so if you can't use a condom and you have achieved the family size of your desire, then why not go in for a vasectomy?
Wow.
Yeah.
Okay, but is it really helping? Does it work? How has been men's perception of this kind of method?
Well, with the right information, that's why you see in developed countries we have, very many men, coming in to take it on. But you see in the countries that are not yet there, or what we call the developing countries, you find that it has not been really taken up with ease, given that we have a lot of cultural, religious affiliations and attachment to lots of the things that we do. So recently there is a friend of mine who quoted for me a scripture in the Bible. Yes. That he thought relates to vasectomy. So he was telling me Deuteronomy chapter 23 verse 1, which says that no man whose testicles are crushed or penis is cut off will be a part of the assembly of God. And I was open to him and I said, that scripture has no relation with vasectomy, because the reason why it's been hard to take it on because there is lack of information. There's a very huge information gap. Most people think vasectomy involves taking out the testicles. Like by the time you hit a vasectomy, by the time you're heading home, your testicle sac, or what we call the scrotum, is empty. All the testes have been taken out. No, it doesn't work like that. We only cut a very small segment of the tube that's supposed to transport the sperms from the testicles all the way to the penis. So once we cut that, everything goes back to normal. You may not even tell that a vasectomy was done unless I confess to you that was done. So you see that there's been having back and forth conversations with men, because again, in the aspect of culture, men think if a man cannot father anymore, he's no longer a man. If a man can't father, And that alone stems in the stigma and the bias we have when it comes to infertility. Because you see that if now you cease to be able to produce children naturally, you're not regarded as a full man. So it means those men or those women who are born with that inability to produce children, they face a lot of stigma, again, in the same context.
Exactly, yeah. Especially surrogate mothers and, you know, things like that.
Exactly, because you'll always be underlooked, you'll always be looked in a certain way if you have that inability. And when you look at statistics medically, we have close to 8 to 15% of the general population being born with that inability to father children or to conceive naturally. So you see that if we keep having this stigma coming in back and forth, it will affect lots of things, including vasectomy, because vasectomy just stop you from being able to pregnant someone.
The inability to give, to father, to give birth.
To father and conceive.
Or to conceive. What does that mean? Does it mean that I can't impregnate naturally, or I can be in a position I can't impregnate naturally, but there is I can do it artificially?
Okay, good. Thank you. The good thing you brought it up. So for men who have had vasectomies for maybe a while back, 10, 15 years, and maybe they change their minds, they'll be like, you know what, I did this back then, but I kind of feel like I need to have a child right now. So there are certain procedures that we can do that involve surgical extraction of sperms. There's what we call TESE and PESE, where for TESE we have testicular, we take you into a fertility program where we can surgically extract the sperms. And for PESE we can get a tube that we can pass all the way from the outside all the way to the testes, and then we can extract the sperms. So once we extracted the sperms, we can now inject them in a woman, what we call in vitro fertilization, and she can be able to give birth. Again, a very expensive procedure, and still success rates are very questionable.
Ooh.
Yeah.
Wow, that means that the natural method remains safer than this. That the artificial comes to alleviate the failures of the natural.
Yeah, that's why it's very important for a man who is going to make a decision when it comes to vasectomy. You need to be very sure of what you're walking in.
Okay, so take us through the process. How do I conceive the idea of vasectomy? What processes do I go through?
So one, I would say a decision should be unbiased. It shouldn't be coerced. It should be a decision that comes from within. Now, once you get the idea that, oh, you know what, as a man, I think the number of children that I have are enough. So once you've made that decision, you have to explore your options. What are some of the options that I have? So you see, as I said, men, we have very limited options. So you're either thinking about using a condom or you're going to have a vasectomy done.
Okay.
Now, once you're not comfortable using a condom, or you've not really succeeded properly with a condom, or with some reason or the other you cannot go on with the condom, then you have to start thinking about vasectomy.
Okay.
Now, when it comes to vasectomy, once that idea hits your head, it's always important to consult. If you're married, your partner should be the immediate person you consult from. Because, I mean, this is a decision that you'll have to carry along as a family, not as an individual. Then 3, if you want to talk to friends, that's very beautiful. Please have a word with your friends. But still, as I said, that very limited information is out there. So most of the friends will discourage you that, you know what, that procedure, they will cut off your testicles. I've had men who had a vasectomy and then they lost their lives. Stories like that, they're always there in the community. So the best place to get information from is if you consult a health worker. Now that's where I come in. All
right. Producer, if you could get me the pictures of vasectomy that we may take a look at exactly what do they cut and how does it happen? Because I trust as you communicate, the viewers out there would like to really take the real image, what really happens. Because some people, when talk about cutting, what comes in people's mind, when talk about surgery, people have got, just imagine things, you know, you cut here, you take off my, you know, this man wants to take away the joy of my salvation. Anyway, I'm kidding. But what do we know and what don't we know about vasectomy in a nutshell?
So still, I'll follow on with the conversation that I'd started.
Yes.
Beautiful. Those are very beautiful images. So you see, when a man makes that decision, you come to the facility, we walk you through the possible options that you have.
Okay.
And once you still insist that you want to go on and have a vasectomy done, then we walk you through how the procedure is going to be like.
Yes.
So we tell you the benefits of the procedure, the side effects of the procedure, how will the healing process be like, and what are the expectations after the vasectomy is done. Now, with regards to the procedure, that is exactly what is done. And how we approach that, it's not a surgery.
Okay.
It is a minor procedure. So with that being said, we don't take you to theater, we take you to what we call a procedure room.
Okay.
And as you see the testicles, the skin that is outside the testicles, what we call the scrotum. So that's where we approach. So we don't touch your penis at any time. So all our focus is just on the scrotum, that skin, that sac that contains the testes. So we make a very small nick on the scrotum, and as after we bed the nick, we access those two tubes. So there is the right and the left. Just the same way we have two testes. We have the right testes and the left testes. So we tie, and then we cut. You can see some strings on those tubes. So we tie and then we cut. And after we've cut, we then put some dressing on the wound because there is a nick on the skin, and then we'll let you go home. So we'll encourage you in the first 3 months to at least have 20 ejaculations, or in layman what they call coming. So you have to have 20 ejaculations.
That means that you have to meet your woman, your wife, for a long time, for several times.
I would say, but there is another option. You can ejaculate as well.
Oh, okay.
Yeah.
All right.
Yeah. So the reason why we tell you to have 20 ejaculations is because we want you to eliminate the residual sperm. So as you see, the tube is cut, but at the time the tube is cut, most of the time it's filled with sperms already.
Okay.
So once we've cut, then we encourage you to at least ejaculate as many times as possible so that we can clear out all the sperms that might have lagged in the tubes. So once we've cleared that, we'll invite you back after 3 months. Give us your semen sample, we have a look at it, and then we're able to see if there's sperms left or not. Now, with that, the big question is always, as a man, once the tubes are cut, will you be able to produce something at the end of an orgasm?
That's a big one.
That's the question. And that's why most people will be like, I can't have a vasectomy done because what will I produce at the time of climax? This is a very beautiful image. You can see there is a very important gland called the prostate gland, and you see that as the sperm tube runs from the testes, it goes all the way to the bladder. Just behind the bladder, there is an organ called the prostate.
Yes.
So this image is kind of obstructing the path of the tube behind there. But it just goes from the testes all the way to the prostate gland. And from the prostate gland, it's able to move to the urethra, and you produce it at the end of the opening of the penis. Now, that prostate gland produces close to 70% of the semen.
Ooh.
So it means even if we cut the tube, the prostate gland will stay active.
Ah, I can see the tube which goes to
all the way
penis
to the
and okay.
So it means even if that sperm tube is cut, you'll still be producing semen at the end of every.
So you still have an erection?
You get a very proper erection, nothing changes.
All right.
And at the end of every round, you'll be producing something.
Ah.
Yes.
But
the only difference will be there will be no sperms in that sample, whatever you produce.
Okay.
That's the beauty of vasectomy.
So maybe would you help us to differentiate between semen and sperms?
Good. So what you produce at the end of what we call every sex round, is what we call semen. So semen is the largest set, and within semen we have the sperms.
Okay.
So you see all that fluid that you produce is not sperms. It's called semen. Or some people may produce it as semen. Okay. And within that fluid is where we find the sperms. So the sperms are very, very tiny. You can't even see them with your eyes. Yeah. So though been raised to think that you produced sperms, you produced a collective called semen, and in that semen, sperms were in that semen.
In every collective semen, there are sperms?
Depends. So there are some men who are born with inability to produce any sperms.
Okay.
So, but ideally, it should be there.
It should be there.
Yeah. But we've seen cases where men come to hospitals struggling Because
so what causes sometimes when a man goes for intercourse and they don't impregnate a woman?
So it's medically we say it's 30-30-30. So 30% of the time it's the women. Maybe they have a problem.
Oh, okay.
Maybe they have that inability. They are having infertility. Then 2, it could be the man. 30% of the time it's the man.
Okay.
Either you're having abnormally shaped sperms, you're producing sperms but they're unable to do anything. They can't even swim. They're abnormal in structure. 2, it could be the number. You have a very low sperm count, or at times there is no sperm at all.
Okay, sperm count, what do you mean?
So sperm count is if we get your sample and we analyze it in the laboratory, how many sperms are we able to see?
Or how many are they supposed to be?
For someone to have an ability to produce a child, you should have at least 10 million per sample.
Ooh.
Yeah. So anything short of that can be negotiable, but if you have less than 5 million, then you'll really struggle to have a child.
And 10 million, only one has to go. The lucky one.
Yeah, that's how God created this
enough
wonderful
wastage.
thing. So still, as I was finishing it up,
yes.
So 30% woman, 30% man, and 30% it's between the two. So it could be, we've seen men who have come complaining with their partners that we've struggled for 2 years getting a child. And then you'll be like, oh, how are you guys having your sex? I'll tell you, you know what? For us, we're using the anal part of it. So it means if you're not using the right way, sperms are deposited in the wrong place.
Okay.
So it means most of the time you won't get pregnant. So we have to always tease out to find out what exactly is deterring this couple from getting a child.
Wow.
Yeah.
Doctor, we're going to take a break, but when we come back, I wanted us to you to dive us into the disadvantages of vasectomy, because where there are advantages, there are definitely disadvantages. What could they be, and how do we go about them? When we come back, it will be that.
Focus. Focus on Healthy Morning. Bethany TV for Health. Showing on Bethany TV. Nutrition Sport. Transforming the way you eat and live. Join us as we explore the power of food and how it transmutes your life, guiding you towards a path of balanced nutrition and the state of being strong, active, and energetic. Witness incredible transformation as we showcase real people who have embraced nutrition sports principles and have achieved their health goals.
Get ready to embark on this incredible journey with us as we unlock the secrets to optimal health, energy, and long life. Remember, it's time to nourish your body from within and live to the fullest.
Nutrition Sport, Thursdays, 8 to 9 p.m. and repeat every Friday, 10 to 11 a.m. only on Bethany TV for Health. Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and Afro mobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for Health.
Health Minutes on Bethany TV.
Aging increases the risk of chronic diseases such as arthritis and type 2 diabetes.
As we get older, we are prone to having chronic illnesses Most of these illnesses are preventable by doing simple things.
Adapting and maintaining a healthy lifestyle and healthy habits can help older adults live longer and healthier lives.
Such as drinking enough water throughout your day.
Engaging in physical activities like gardening, taking walks helps maintain healthy weight.
Doing exercises, for example, walking. You can do as much as 30 minutes every day of your life. Having a balanced diet, eating good food, avoiding so many oily things.
Maintaining interaction with family and friends to avoid isolation and loneliness as they are associated with depression. Scheduling regular checkups with the doctor to catch health concerns early.
Better healthcare for a better tomorrow. That was the Health Minute.
abavuga emotoka ate nga tuli ku kkubo naye ate tugoberera ennyo emotoka ezituli mu maaso, ebintu ebyo ebikyasinza okuleeta obubenje okusinziira mu statistics zaffe. Kati kino kikulu nnyo bwe tuba nga tuvuga, lekawo gaapu makatiwo n'emmotoka ekuli mu maaso, kintu kikulu nnyo kubanga oli waba nga afunye ekimubaddewo oba n'asiba ekitegenderedde oba abruptly, kiba kitegeeza nti ojja muyinyira okuva emabega ate n'oleeta akabenje. So lekawo gaapu kikusobozesa okuba nga osobola okutegera buli kintu kyonna nga oli ku kkubo ng'otambula.
Today on Bethany TV. Today on Bethany TV. Bethany TV for health. Focus on healthy morning.
Welcome back. We're tackling vasectomy and men's perspective of this idea. And Dr. Blair is in the house and he's really demystified this mystery way deep. And now we want to look at the disadvantages, having tackled all what we know, what we don't know, what vasectomy is and how it can work. What would be some of the disadvantages, Dr. Blair?
Okay. So thank you so much. So as health workers, we're obliged to, whenever you talk about something, you have to tell us the benefits and the bad things in it.
Okay, the bad things.
Yes, so you have to tell the client what are the benefits and what's the downside of it.
Okay, the downside.
So the downside, one, if the procedure is not done properly, you find that in certain instances we have infection coming into the picture. Especially if they're not being cautious enough in terms of how they dress you up, the cleaning process, and how they approach the process. So we've seen instances where some have ended up with infections. That is if it's not done in a proper facility. The number two, I said it involves the nicking of the skin. So anywhere we have a break in the continuity of the skin, we expect some bleeding to happen. So if that bleeding is not controlled properly in theater, or if it's not identified at the right time, we have seen instances where it has gone on to form what we call a hematoma, which is a collection of blood in the body, and that could be a problem as well. But if it's noticed early, then we can find a way to mitigate it. Number three, we've seen lots of psychological part of it, which I mentioned at the start of my discussion, what we call regret. And regret usually comes if you've not been given adequate information to make this decision, because as I said, it is permanent. So for something that is permanent and irreversible, if you do it without adequate information or without a very good thoughtful mind, then you will have to regret later on in the future. Other complications include sperm cramps.
Sperm cramps?
Yeah, that usually comes when you have what we call granulomas. So there are some tiny masses that can form in the tubes.
Cramps like menstrual cramps?
Yeah, it would be painful, yeah. So it's pain that comes in a pulsating manner, so we call it cramp.
Permanent or?
So it depends. If the problem is sorted, then you won't keep having it. Then on some rare instances, we've seen men that have complained with chronic pain at the site where they did the vasectomy. So it means you have the procedure done today and you stay for 10, 20 years having pain at the site. And that used to happen more in the old method of providing vasectomy, which involved cutting. But these days we no longer cut, we just make a very tiny skin and we bluntly open up until we get the tube. So that used to be a problem back then, the chronic pain, but these days we barely have anything like that.
All right. So what could be the benefits then?
So the benefit of the procedure, one, as a man, you have full control of when and how to have children, because we've seen cases where women go through corners. They tell you I've taken the pill, and they've not taken the pill. You send them money to buy the Postina, and they go and buy a Rolex. So once you've had a vasectomy, such cases will become a mystery, because you're now very sure that I will not have any child that I've not intended or planned. Then two, it's very beneficial because we've seen that with limited uptake of family planning, we're having unintended pregnancies, and most of them end up in unsafe abortions. So rather than having our young girls, our sisters, our cousins, our mothers succumbing due to unsafe abortions, once you've had a vasectomy, we will not have cases of unintended pregnancies that may result in unsafe abortions. The number three, as we say, vasectomy is an act of love. It's even here on my badge. It is an act of love. It takes strength, it takes willingness, it takes courage to have a vasectomy done. And it's a very good method of family planning, as it is for other methods. Because on the downside, we've seen women that have suffered for long due to hormonal side effects of some of the methods of family planning that we have. You realize that the pills that we take, the injections that women take, the IUDs, the implants, all of them are stuffed with high levels of hormones. And when someone starts taking it, as medics will tell you that some of the side effects include cancer, like the way you see endometrial cancer, the way you see ovarian cancer, the way you see breast cancer. Some of those cases are actually inclined due to in one or the other use of family planning methods, especially the hormonal ones.
What I'm saying here is that vasectomy will actually is beneficial to women as well.
Yeah, it is, very much, because we've left the burden of family planning to women. Now, if we as men become participatory in the right way, then we'll save a lot of women. So it means we'll even have a decline in the number of cancers that we have, that we see on a daily in women.
Yeah, those side effects, sometimes they have excruciating back pain, excessive weight gain.
Exactly, mental illnesses, depression.
Yes.
We've seen lots of depression cases due to family planning methods, and hence the suicide cases that we see on a daily.
Wow.
The mood swings, the vaginal dryness. We've seen a lot of, it's a very huge spectrum of side effects. The infertility as well.
That's where I was going. You took it from my mouth.
Infertility. Infertility. We've seen women that go on a family planning method and they never conceive again.
Especially the young girls who ignorantly, relentlessly swallow pills.
Exactly.
It really had a great impact on them. Doctor, who is eligible and who is eligible to
Very
this?
beautiful question. So yesterday, still in a space, I was asked the same question. Should vasectomy only be left to married men and women? Should vasectomy only be agreeable to a certain age? But I would say this. It's always very important to look at the pros and cons of vasectomy.
Okay.
and to understand how the decision came about. We've seen men, especially young men, who come in to have a vasectomy done because they've been heartbroken. Okay. This one girl broke their heart, and now they're tired. They don't want to see any child anymore.
Making a permanent decision in a temporary situation.
Exactly.
Oh, right.
So we do not encourage that. And the reason why we do not encourage that, because we understand it is a permanent method. So ideally, vasectomy best suits someone who has had a child. At least a child. So I cannot stipulate how many children you should have for you to make a decision to have a vasectomy, but all depends on the economy. If you can only support 2 children once you get them, so why not?
A person who has had a child, not children.
A child at least.
Oh,
yeah.
Okay.
Because we've seen people that say, for me, I only want 1 child in this life, and that's it for them. And there are people who say, my target is to have 3 children, and that's it for them. People who say, my target is to have 8 children. Now, once you've hit that target, please, why not get a vasectomy instead of seeing your woman go through the side effects of these modern methods of family planning. So I can't stipulate the number of children because that depends on the situation and the desire of a man. The number 2, the age factor. Still, that's very much debatable up to date. There are countries where it's allowed as long as someone is older than 18, because when you're older than 18, you can make a sane decision. You're not a baby anymore. Okay. So if you're older than 18, we go through rounds and series of counseling, and you're very determined that you want a vasectomy done, then please, why don't go for it? And there are countries that are so advanced in technology, like the US, also the countries that are up there. There are certain conditions that are moved in a genetic way. There's a terrible disease called Huntington's chorea, and that's a disabling disease. And once someone has it, rarely do they make it past the age of 30.
Okay.
And that disease is passed on from father to child, and so on and so forth. So in certain instances, like those, vasectomy can even be done at an early age. Because if you see how exactly it has affected your grandfather, or how it has affected maybe you as a person who has it, you wouldn't want to let it go on to the next generation. So you can have a vasectomy done to prevent this kind of condition from being passed on to the next generation. Again, still the age issue. So it depends on the laws, the guidelines in place in a country that will dictate the right age at which they feel like vasectomy should be done. There are countries that feel like someone should be older than 35. There are countries that feel that someone should be older than 40. There are countries where people feel like it should be done by someone who's older than 50. And there are countries that believe that vasectomy can be done for someone who's 18 and above. And there are countries where even those that are less than 18 can have a vasectomy done as long as their parents consent to it.
Have there been incidents when a person did a vasectomy and they impregnated a woman, just like sometimes people who have, employed contraceptives like women, all those types, and before you know it, they're conceiving?
Yeah. So they said once a vasectomy is done, we encourage you to have 20 ejaculations so that you clear your tube properly, kabisa. And we as well call you back after 3 months to examine the semen sample to see that there are no sperms entering or coming along. So the reason why we call you back after 3 months to analyze the sample is because we want to be sure the process was successful. There are instances where some health workers have done a vasectomy and they tend to think it was a success. They don't even call clients, or clients defy to come back.
Before you know it, someone is impregnating
someone's
daughters
on the village. And that comes to incompetence and lack of proper technical skills to handle a vasectomy. But if it's handled very well, we've done semen analysis at the right time, and we're sure there are no sperms in, then you can't impregnate someone. But if we've not done a proper follow-up, we've not analyzed your sample one more time, then there is a likelihood that there was a failure rate, and hence you're impregnating people. And in the first 3 months, as I said, we encourage you to have 20 ejaculations. Those 20 ejaculations have sperm in it. So if you don't use any method of family planning like a condom or if you don't use maybe what your woman has been using, what your madam has been using, if you do not continue on that for like 3 months, then it means there is a likelihood that you can end up impregnating your wife or any other person that you sleep with.
What are some of the chances of those tubes rejoining themselves?
We've had some rare instances where the tubes have rejoined, and that used to happen in certain methods of vasectomy. For instance, if you look at those pictures on the screen, there are certain situations or where we use only to tie and not cut.
Okay.
So we just tie and then we put you back.
Isn't that better than cutting?
That's what people used to think, but chances of rejoining are high. That string can snip, and then the string on the lower side can snip as well, and before you know it, the tube is patent again, and sperms are moving, going to the semen sample. So that's why this time we tie and cut. Yeah.
Wow. Doctor, take us through the recovery process. What happens? Some time ago when we went for COVID-19 vaccinations, the recovery effects were quite, and they could trouble certain people. Some people would react differently, others would not. So are there some reactory, incidents that happen on the recovery? Okay,
so once a vasectomy is done, the recovery period is usually like this. So immediately, as I said, we leave a bit of dressing.
Okay.
Or what most people are used to, they call it plaster. Okay? So we leave that particular dressing at the site where we snipped the skin. Then we encourage you to leave it on for at least 12 to 24 hours. Now, once that's done, we encourage you to remove it and do proper cleaning. So you look at the scrotum is very close to the anus, or this is the genitoperineal area. So if it's not taken care of properly, then you can actually end up with an infection. So we encourage you to have a very closer look at it, clean it properly, and ideally within 3 to 5 days the wound should have healed, because it's not a very big wound. So within 3 to 5 days your wound should have healed, and we encourage you to pace yourself in terms of getting back to full activity. You can't have a vasectomy today and at night you're having sex. You can't.
How long does it take?
Ideally, we give you 72 hours.
Okay.
Because we want the healing process to occur to a certain extent. We've seen instances where a man gets a vasectomy in the morning, in the evening they're having a shua. So they sleep with a shua, and the following day they are calling you, doc, my scrotum is big. And the reason why that happens, because because sex is a very rigorous activity. You'll have back and forth trauma onto the area that has already been operated on. So some vessels might rupture or might give way, and bleeding will start happening. Now when bleeding happens, as I said, it will accumulate in the scrotum and it will come back when it's very big. We can still handle that, but you wouldn't want to have that complication happen.
How are you going to move? And
Exactly. So that's why we encourage you, please give yourself time, rest. Even if you're having a shua, tell the shua to wait. Anything that can't wait is not good for you.
There is a time when men went for circumcision and they were told to avoid any erections. Exactly. Because it might cause some, funny feelings and everything. So is it the same thing to vasectomy? Are you supposed to avoid any erection, don't think about anything or something like that?
So as I said, for vasectomy, we don't have anything to do with your penis. So please, you can have your erections as you want.
So the erection can't affect?
It doesn't affect it in any way.
Yeah. All right.
The only problem is if you have physical contact with the area that has been operated on, that's where the problem is.
Okay.
But the rest, your organ system, your penis is still intact and working properly, and an erection can't deter you from anything.
During the recovery process, we've had complaints of people who developed some tiredness, fatigue. Are they some of the expectations?
I wouldn't say that, but I would think why they may get the tiredness, the fatigue. It's because some of the medications that we give you after the procedure. We give you some antibiotics in some instances because we can't be sure of your hygiene, so we don't want you to end up with an infection. So we can give you some antibiotics to protect you from that. Now, those antibiotics can have side effects. The fatigue that we see, the tiredness, the headaches, the nausea, vomiting, those are not related to the procedure, but they are related to the medication that we're giving you. We'll give you some painkillers as well, because, we just opened your skin. there's an element of pain coming into play. So even painkillers will have their own side effects. So you can end up with a headache, you can end up with a tiredness, you can end up with a fatigue. But directly, the vasectomy that is done can't give you the tiredness, can't give you the headache. The same way, no one gets circumcised and they say, ever since I had my circumcision, I'm extremely tired. It has no relation to it.
It has no relation.
It has no relation.
Wow.
Yeah.
So does it anyhow prevent you from certain diseases like infections or maybe HIV or whatever, or something just like this? I mean, the phrases on circumcision, that when you do circumcision, there are minimal chances of getting HIV, and there's any attachment to it with vasectomy.
So I would want to dispel this myth. Vasectomy doesn't in any way protect you from getting HIV. Neither does it protect you from getting STIs. Because as I've explained again and again, when you look at how HIV is gotten and some of the STIs are gotten, it's contact, skin to skin. So it means your penis, as I said, we don't touch it at all. So it means your penis is still intact, the skin is still intact, and you're properly exposed the same way someone who is not, who has not had a vasectomy yet. So it doesn't protect you in any way from getting HIV or any STIs. However, if you look at the history of vasectomy, the earliest vasectomy was done in 1823.
Jesus Christ.
It was done in London. By some famous,
way back, over something like over 100 years.
Yeah, actually, yeah. So it was done in London, and the essence of it being done was they thought that it protects men from getting prostate cancer.
Okay.
So that was the main reason why vasectomies were done. It wasn't for family planning.
Does it?
Studies that have been done have said yes and no at the same time. We have studies that have shown that if men are sexually active, if they ejaculate more, the more you ejaculate, the lower your risk for prostate cancer. And we've had a contradictory study saying that the less you ejaculate, the lower the risk for prostate cancer.
Okay.
And we've had another study that have said your rate of ejaculation has no impact in any way when it comes to the risk of prostate cancer. That's why I'm saying it's a yes or no. But you look at earlier studies that were done, they thought that if you have a vasectomy, then there is a very lower risk of you getting prostate cancer.
Okay.
And that's why we see in medical, there's what we call medical castration. If you're having early stages of prostate cancer, we can take out your testes and protect you.
Wow. Lastly, doctor, myths and misconceptions.
So myths and misconceptions, I've tried to dispel a couple of them as the session went on.
Yes.
But some of them are really rooted in religious and cultural context. So one, vasectomy is permanent.
It's not just to stop Africans from, the populace increasing.
Yeah. I know lots of people have
it's not a white man thing.
Exactly. Lots of people have conspiracy theory that you see it's a white man thing. You've been funded to stop Africans from multiplying.
Yeah.
But as I said, vasectomy is like a method like any other, and it's a birth control method, but it is permanent on the other hand. And what people don't know is women also have a permanent method called tubal ligation.
It's very, very rare.
So actually there are 10 times more tubal ligations done than vasectomy.
Seriously?
Yeah, women are having their tubes tied.
We need to dive into that one of these days.
Because you see, men are okay with women tying their tubes, but they're not okay with their tubes being tied and cut. Interesting, right?
A lack of information?
I kind of feel like it's more of an ego thing. It's gender inequality. Because you're okay seeing a woman having her tubes cut, but for you, that's a no-go area. As a man, you know, sigalao. So,
Doctor, that camera, your last words.
So I would say that vasectomy is a method that should be embraced and should be embraced for the right reasons. Enough information should be provided before you make a decision to have it done. And 3, vasectomy is an act of love. It's an initiative taken by a man who is responsible enough to see that I've had the right number of children that I can support, and there is no more for me. And rather than letting your woman go through the toll of side effects of these modern family planning methods, taking that bold step as a man is truly and beautifully an act of love.
Wow. Yes, that's it. Dr. Blair Chiza, their general practitioner, and we've been understanding and tackling vasectomy and the men's perspective of it. Thanks for joining us. My name is Jinto Mutisasi Senior. Until we meet again tomorrow, make sure you take care of yourself and your country. Bye.
Focus on Healthy Morning.